So welcome to the Hate File 5 in 5. This is the feature where we're going to be serving up the juiciest morsels of wisdom from the Hate Files. I'll be endeavouring to do 5 key takeaways in 5 minutes, hence 5 in 5. So this is perfect for when you want all the insights, but you only have time for the highlights. So sit back, relax, and let us deliver the best bits, no fluff, all flavour. In this episode, I'm going to be reviewing my conversation with Dave Taylor, CEO of Valley Diagnostics. Now, he's in the thick of building a startup focused on early cancer detection using non-invasive urine-based testing. He's still in development, he's still raising funds, and navigating everything from regulation to data to purpose. So here are 5 things that really stood out, plus, as always, one actionable step for each one of those takeaways. So number 1 takeaway is be led by the need, not by the tech. Dave's first big message was don't start with the cool technology because it's very easy to do that. Start with the problem. It's easy to fall in love with innovation and try to find a problem to match it. But in healthcare, that never works. Too many innovations are built around tools and not pain points. And in healthcare, if it's not solving a validated need, it won't gain traction. So talk to clinicians, patients, buyers, and keep peeling back the layers until the need is undeniable. So action point, book 5 interviews this month with frontline users or buyers, ask them what's broken in their process, then build from there. Takeaway number 2, you need data before you can get cash, but you need cash to get the data. So it's a classic chicken and egg dilemma. Investors want proof that your product works before they'll give you money. But without money, how do you generate the proof? So the approach that we discussed was build relationships early, piggyback on existing studies, and find ways to gather evidence however you can do that. And most importantly, start collecting data as soon as you possibly can. So the action point that I want you to do here is list 3 academic or hospital partners that you could approach this week for a potential pilot, a study, collaboration, or an access, or to gain access to biobanks, samples, anything that you can do that can help start you to get some case studies and some pilot projects this week. So takeaway number 3 is that NHS systems are slow, and so are all the systems around the world, to be honest, when you talk about hospital systems. Therefore, we need to build from the ground up. The NHS doesn't change overnight. We all know that. Even if your product is better, faster, cheaper, adoption is going to be hard. It's never that easy. It's unlikely, therefore, that you'll disrupt the NHS from the top, unless you have some of those real top-level contacts. And even in that situation, it still will be very, very slow. So the strategy that we discussed on the show was don't start with a national rollout, therefore. Start small. Partner with local hospitals, run your test in parallel with current diagnostics, build your evidence base and scale from there. Bottom-up buy-in beats waiting for top-down change. You really need to build some bottom-up momentum. So the action point to take away here is identify 1 local hospital or clinic where you could run a small-scale evaluation alongside current standard practice. Reach out to them this week with a specific proposal. So moving on to takeaway number 4, price isn't everything. Health economics is. This is one of the challenges that many founders face because they think if my product costs less, it will be adopted. But being cheaper isn't always enough. And actually, it isn't enough in most cases because buyers care about outcomes. They care about resource use and they care about system level efficiency, i.e. it's about value across the system. And what we discussed on the show was how time savings, clinical hours, patient stress, and faster outcomes all feed into true cost benefit, especially in places like the NHS. These bigger picture savings are what really matter. So you need to calculate your true economic value, not just your product cost. Action point, map the full diagnostic pathway your product replaces or improves. Identify where you save time, resources, or reduce harm, then build your health economics narrative from there. Moving on to the 5th and final takeaway, that's vision and values are your real fuel. And I think this, to me, is one of the most powerful insights because when cash is tight and progress is slow, your vision and values are what keep you going. And Dave actually said it best. Stick to your values, come what may, and that will help you achieve the vision. And as I say, In tough times, it's your values and mission that carry you forward, not just spreadsheets and roadmaps. Keep your eye on the impact because purpose gives resilience. In medtech, it's not just about the money. I'm not saying the money is not nice, but it's not just about the money because we could be selling anything. It's about making a meaningful difference. And that's what drives the people who last. So the action point is write down your company's 2 to 3 core values, share them with your team this week, and discuss how you're living them or where you're not. And if you need any help with that, just drop me a line because, vision and values are one of the things that I love focusing on. So that's it. Thank you very much for tuning in to 5 in 5. If you enjoyed this episode, then share it with someone who could use these insights and also direct them to the full conversation with Dave Taylor on the Hate Files, especially if you're in diagnostics, cancer care, or you're just figuring out how to survive the early startup grind. Don't forget to subscribe and join me next time for more practical wisdom in just 5 minutes. Until then, keep learning, keep growing, and keep making an impact.